Hi, I'm Jill Vitale-Aussem with the Eden Alternative. Thanks for joining us today for our Eden Alternative live show. So if you're out there watching, let us know you're here. Pop your comments and questions in the comment box. We would love to hear from you. I'm really excited today to have Penny Cook, who is the president and CEO of Pioneer Network, with us today. And I've known Penny, I don't even know how long we've known each other.
Years.
We've known each other. And Penny and I are both located in the Denver, Colorado area, which is fantastic because we collaborate a lot. And Penny, before joining the Pioneer Network, and I think this is maybe where I met you, Penny, when you were the manager of the Long-Term Care Ombudsman program in Denver. And also Penny ran the Colorado Culture Change Coalition for a long time and made a huge impact there. And right before coming to Pioneer Network, she was the director of long-term services and supports for Colorado Access, where she managed a state Medicaid contract to connect individuals to long-term services and supports. So Penny, thank you so much for being here with us today.
No, thanks so much for inviting me, Jill. I'm excited about our conversation.
I am too. And we're going to be talking today about what does the future of aging services look like? And, this pandemic is the biggest crisis our field and probably our country, our world has faced. And it'll forever change things in aging services. And Penny has the unique perspective, as we do with Eden Alternative, of working with just a variety of organizations and people. And so it's a great way for us to get together, talk about what we're seeing. We'd love to hear from all of you, what you're seeing going on in this space, what your thoughts are on the future. But let's get started. Before we get started, we should probably take a moment and talk about the Pioneer Network and the Eden Alternative. I think people get confused sometimes about, what are these two organizations? How are they different? How are they similar? So Penny, would you talk a little bit about Pioneer Network?
And Jill, you went off for a while, so I wasn't sure the question, but I think we're talking about our organization. So
yes,
I'll start there with Pioneer Network. So Pioneer Network began in 1997, and one of our founders is the founder of the Eden Alternative as well. Well, two of the founders, Bill and Jude Thomas. But Pioneer Network developed as sort of the umbrella organization for the culture change movement. So Pioneer Network, we've never been a membership association. And what we have been is an independent place for everyone to gather. And so we've never just promoted one model or one philosophy for the path of culture change. It's really bringing the whole idea forward and providing education and resources, dissemination of best practices, so that anyone who's on their culture change journey can have the resources specific for them to get there. And we've also been the convener. I feel like, in some ways we've been able, since we are so independent, to convene multiple organizations together to move the culture change movement forward.
Awesome.
We've always been happy to have Eden as one of our partners.
Yes, and we are thrilled to be a partner with Pioneer Network. And so just for those of you who are watching, if anyone isn't familiar, thanks Penny for talking a little bit about Pioneer Network. And the Eden Alternative is just over 25 years old. And we work with organizations around the world. Last year, we were in 19 countries, working with organizations to really shift the culture of care. So we do consulting work and education training. We have a very strong framework called the Path to Mastery, which is the steps to driving sustainable change. And we have our Eden Alternative Registry, which are homes that have committed to driving this change. So, and again, when we love collaborating with Pioneer Network, we've been doing a lot of fun things together this year, our Better Together webinar series. And so it just makes sense that we get together and talk today. So to really, I don't think you can always talk about the future without really acknowledging what's happening today. And what's happening today is a lot different than what was happening 3 months ago, even 2 months ago, because things are changing so rapidly with what we're learning about, the coronavirus, with how cases are, expanding in certain areas and they're getting better in other parts of the country and other parts of the world. So, Penny, what are you seeing? What's the reality of where things are right now with aging services providers? What do you think the biggest challenges are that they're seeing?
I think that there are so many challenges right now because of just what you said, Jill, that things are changing so quickly and it's different for everyone. I think that when the virus hit, of course, our first reaction as a country and in aging services too was to shut everything down. And I think that that was appropriate because we just did not have the information. Enough information about the virus, about how it was spreading, how to ensure safety, how to take precautions. We didn't have enough testing, all of those things. But now we're at the point where, as we all know, there are some states that are reopening. There are some states that have reopened and have had to go back. For our senior living communities, they've been closed down now for so long that, of course, we want to ensure that there is reopening happening, but now we have these hotspots, quote unquote. And so it makes it really difficult. So I think the biggest challenge is just trying to keep up with what's going on in your own little community. And I say that because it's not even a state by state approach. It really is, in some places, not even city by city. It's really what's happening in your community. And I think that that is so difficult for those who are providing services and supports.
Yeah, and I would say also, and as a family member, and hearing from other people who have loved ones living in a congregate living setting, is this whole challenge of seeing the city around you, maybe the town around you, where in some parts of the country, right, where it's like life is back to normal. We all know it's not, but that people are getting back to some semblance of normalcy and are going out for dinner and are seeing people, in people's backyards, doing things as safely as they can. But if you're over a certain age and you live in a community, you're still being told you can't do that. And that is such a huge challenge, I've got to imagine.
Well, I think it's such a huge challenge for so many of
I think Penny froze up a little bit here.
I think I did.
Okay, you're back. Yay.
I think that senior living communities feel like they're between a rock and a hard place because, of course, they want to ensure that the people who are living in their community are as safe as possible, as far as, and this is a physical safety. But then we also have, as you said, things reopening and people wanting to sort of regain their lives back in a sense, especially since this has been going on for some people since March. And so I think that that's the challenge, is how do you balance that? Yeah. And it's one of those questions that, as you know, we've talked about for so long in senior living. How do you balance the risk? And this is one of those cases that it, totally exemplifies what we have talked about for so long.
Yes. And it's and as an ombudsman, I know that you've always focused on this in your role. But the whole notion of people have the right to accept risk in their lives, and the huge challenging situation here is you're not just accepting risk for yourself, you're putting anybody who you come in contact with at risk. And that just adds, you know what I mean? Like, if I choose to, not take medications the doctor thinks I should take, or do whatever, if I'm a diabetic and I'm just like, I just want to live my life, eat what I want to eat, live the way I want to live, that's my choice, and that's fine, because I'm not putting other people at risk. And so this is like beyond, it's so complex.
It so is, because we're talking about individual and community. And we have promoted the idea of community so much that's what we're really trying to create is community in senior living. And now we're saying, okay, well, there's that individual risk, but now there's a community risk. Yeah. And as an individual, if you make certain choices, you're impacting the community that you belong to, that you're a part of. And so this really, I really don't think that we have all the answers here. And just so everybody knows, we don't.
No.
And this is why we're talking about it, because this is what we're hearing is one of the biggest challenges for senior living communities, for care communities, and totally understandable. But I really think, and you and I have talked about this before, one of the things that has to happen is that this conversation can't just happen with us. It has to happen in the communities themselves. Yes. These are hard conversations that need to be had.
Yes, yes. Somebody mentioned something last week that I thought was kind of interesting. And she said, and again, there are no answers here. I'm just bringing this up because I thought it was an interesting perspective. What if in congregate living settings, there were cohorts of people who are willing to take certain levels of risk, and I think somebody had mentioned to me a group of women that live in a part of an apartment building. It's not under any kind of licensure, but they've said, we're going to hang out together, like that whole quarantining thing, and accept that risk because it's worth it to us. And we're going to be as careful as we can, but it's worth it to us to have the human interaction. But is that crazy to think that we could come up with something like that? Something where it's groups of people making decisions?
I don't think it's crazy. I think that we're seeing this in our society. We're seeing that families are doing this. We're seeing that friend groups are doing it. So why can't we have something like this in senior living? Because I think it's very true. I mean, one of the things we've always talked about when we talk about the dignity of risk is that we all have individual tolerance for risk. And what is aversive to me may not be aversive to you. And we need to respect that. Well, I think this is a similar case. And I think that if you talk to any group of people who are living in a senior living community, you're going to have a spectrum of risk. And so I don't necessarily think that that's a crazy idea. I think that something like that.
Oh, you froze up a little bit. So you think something like that? I mean,
it's quite possible.
It's worth a conversation, right?
Exactly. I think that what we're seeing right now is we're seeing more creativity and innovation in senior living than ever before. And kudos to everyone and all of you who are watching who work in care communities, because we're hearing examples of it, as I'm sure you are, all the time. So why not switch things up and try and possibly try this? We'd be fascinated to know if somebody does.
Yeah, and it's that commitment to this group, and I'm going to do the best I can for my neighbors, not just looking out for me, but that's really interesting.
It is an interesting thought. And as I said, I mean, we're seeing this in the larger population. There have been so many stories out there, like I said, about friend groups gathering or large families getting together. And this is the group that you're going to be sort of quarantining with, or at least restricting or your physical contact with.
Right.
So why not?
Right. And we've got to figure out something, right? Because when it seemed like maybe this was going to be, I mean, I'm such an optimist. I'm like, this won't last very long. Or foolish, optimistic or foolish, however you want to frame it. But now that we know that we are going to be living with this for a long time, and you said something to me, Penny, that I thought was just a great way to describe it, is we've responded in the way we have, and there's no judgment, right? We're all doing the best we can. And now it's time to pause and have some of these discussions about, okay, now what? As one of the organizations that we've been talking with says, what's our next normal, not the new normal, because it'll change again. What's our next normal? So I think you have such a great perspective because of your experience as an ombudsman. And I'm really curious, and also the work that was done on the guidelines for family visitation that you worked on and we were part of with Plaintree and numerous other organizations. Where do you see things going with family engagement? And by family, I don't just mean people who are related. I mean anyone who has meaning in an elder's life. Where do you see things going with that?
Well, as I said about the innovation and creativity, I think we've seen so many communities try to set up places for visitation outside and also in their own communities inside that are really creative. But I think it's going to behoove communities to really try to figure out how to incorporate visitation into their community. And so I think some of the things that are going to have to happen, and I go back to this, is that there has to be that communication between family members and residents, family members, and as you said, broader / friends, residents, and staff members about what's possible. You know, it's always better when everyone gathers to talk about these issues. And I think that ensures that residents and family members have a voice and they feel heard during this process, and staff as well. But I think that there's the possibility, if it's predicated on testing, it's predicated on evaluating of symptoms, all of those things. But I think that it is possible to open up your community and have visitation. Again, though, it may be that, you know, you're open for a couple weeks and something happens and things have to sort of close down for a week and then you open up again. So I think that fluidity has to be built in to whatever you propose. I think what we've learned is that nothing is going to be solid. The decision you make today may not be the practices you're operating under in a month.
Yes.
It has to be okay. So I think none of us are comfortable with the fluidity, though, of that. But I think that it's something that we're going to have to look at now.
Yeah, it's hard. The unknown is really challenging, but that's what we're living with right now. Mm-hmm. That makes a lot of sense. Penny, we've got a couple questions. Chris asked, so when we were talking about having these conversations, and I'm assuming she means about the cohorts of people who are quarantining, a conversation with who? State level people and leaders are afraid to put themselves in that position. Safer to say they won't let us. And I think Chris is right. The huge challenge on top of everything else is when things happen and things don't go well, our field, unfortunately, is offered very little grace.
There's no doubt. I think that our field is offered little grace, and we live in a litigious society. And I think that is quite harmful and detrimental to senior living, along with other areas as well. And that's why I will keep going back to involve people in the conversation. I think that when people are part of those decisions, and when I say people, I mean at your local health department level, at your state health department level, your licensing agency in your particular state, I think those conversations have to be had. I know in Colorado, for instance, our governor was reaching out to so many people to try to get input on what to do with nursing homes and assisted living communities, what guidance to give. That's what has to be done. And if those elected officials aren't reaching out to you, then I think that as a senior living community, you need to reach out to them, to reach out to even your local municipality to have those conversations. And I know that it's easier to say, well, you know, this is what they're saying. This is what we're being told. This is the guidance that's being given. But you know what? We have always worked with communities that have pushed the envelope a little bit, who have pushed back and said, yes, but. And I think that that's what needs to happen now. And I know it must be tremendous to have to do this on top of anything else. But I think that for the care and support of the residents who live there and the staff who work there, these are the things that have to be done.
And is it more powerful, do you think, if residents are engaged with making that contact, because it's their rights, right?
It is their rights. And I think that we're seeing more of that now. The longer this goes on, that we have more residents who are standing up and pushing back.
And family members, right?
Family members too. Exactly. Yeah. Exactly. I think so many things are a multi-pronged approach. This has to be as well.
Absolutely. Thank you. That's great insight. So Imelda asked, I would love to have some conversation about how the physical environment of post-COVID nursing homes might look like to mitigate the wildfire rate of infection that so many nursing homes have experienced in this pandemic. Dr. Al Power gave some amazing figures in a recent Zoom meeting about the rate of infection in households versus the long hallway structure. It's a great question.
It's a great question. And I think this is a topic of conversation that is going to continue for months, if not years, about this. You know, all of those things I think that we've been talking about in this world of culture change, especially in regard, for instance, to nursing homes, are coming to light now. Nursing homes were built after hospitals. And as Imelda said, with those long corridors, you know, with used to be multiple, now it's a few people living in the same room. When we're talking about infection prevention, those things go right against infection prevention measures that are needed right now. And I don't think that I know of there's been any other time in history that we've seen sort of the illustration of why these physical environments that we traditionally created truly do not work for residents, and especially in regard to their physical care.
Absolutely. You know, it's fascinating, I think, like all the things that we've been focused on that work for quality of life, smaller neighborhoods with the opportunity to be with other people as well, private rooms, private bathrooms, relationship-based consistent staffing where you don't have, 30 different people taking care of you in a week. Those things are what's best, we know, for quality of life, and they're best for infection control. So yeah, I think that's really important. So how, what it'll come down to, right, is policy changes and funding changes to make that possible, to, reconstruct spaces within existing homes or build new. Mm-hmm. Are there discussions happening about that? Do you know?
Well, I think, yes. I think that people are beginning to discuss this, and people that weren't necessarily probably sold on this idea. I think that, if you see the media attention that have come forward about the household model, about the small house model, about the greenhouse model, I mean, it's been tremendous. I don't think that most people had heard of these different types of models that are going on in senior living really until now. So I think there's tremendous opportunity there. And so people are having those discussions, but I think that you hit it right on the mark where, I think we're going to get to the point where probably no one is going to argue about we have so many nursing homes that are in existence that were built in the 1950s and 1960s that are that traditional model. And so what is it going to take? It's going to take a new funding structure. It's going to take a new financing structure in order to create this. So it's not going to be a quick, easy process.
Right.
I really think that we all need to get together and advocate for that to happen.
Yes.
I don't think anything could have illustrated it more than what's been happening now.
Right. Absolutely. And another thing I want to talk about, because another thing we're hearing about as a solution from different sources and, op-ed pieces is that we should be defunding nursing homes and putting all of our resources into supporting aging in place in your home. And I have some thoughts about that? I'd love to hear yours.
Well, I think that this conversation is one that's been going on for a number of years as well. And I think that there are a large group of people who would love to make the decision to stay in their own family traditional home and receive care and support. And there are other people that, as we know, make the decision themselves, not being pushed by their family members, not being pushed by anyone, to move into a senior living community because they are looking for something else. They may not be looking for the care piece of senior living, but they're looking for the socialization and the support piece of senior living. I don't believe that's going to change. And I want to have options as I grow older. I think that having options are really important. I think that's why we see communities that are 55 and over. And we have some people who say, oh, I never want to live in that type of community because I want kids around me. And we have other people who say, I don't want kids around me. I want to live in that type of community. So I think options are so important. So I don't think we can dismiss the fact that people should have choice.
Yes.
And this is one of the choices that they can have. I also feel that as people need more care and support, there is always going to be a need for a nursing home type of setting. I think it should look differently than traditionally what we have now. And I think that's what we've all been working towards. But I think that there needs to be that option out there too. I would also remind people, my mother is living in her own home and she cares for her husband who really could use some care and support in the home. They don't want to move into a senior living community right now, and that's their choice, right? But right now they're afraid to have people come into their home to provide services because of what you were saying. They're going to have multiple people if that happens. And right now, that's not the best model. So until we could even ensure that people have consistency with home care services, we would still be in the same position. So I just don't believe, we talk about culture change so much in congregate living situations, but I don't think we talk about it enough for home and community-based services.
Agreed.
Because we have very inconsistent staffing that's occurring in home and community-based services, and that's not okay either.
Absolutely. Absolutely. And so I think we agree that staying at home is a very viable option for some people. But to think that it will work for everyone, and I think about my parents who, before they moved into a life plan community, were living in their home, and they started to get isolated and they missed community because they lived in a little town where there wasn't a lot available to them, and they were seeking community and they were seeking a place where they would have roles to play and they would belong. And that's what I used to see when I used to run communities is I would see people who were like, I'm not ready yet. I'm not ready to move in. And they were isolated. And it really starts, we know how dangerous isolation is. And just having services brought into your home, having meals and having healthcare does not a full life make, right? And so people suffer and they live in homes that aren't designed if their mobility needs change. So I think it plays a role, absolutely. And I'm with you. I think we are always going to need opportunities for people to live in whatever that new setting looks like. It's also, if you need the level of care that you would need in a nursing home, to get 24-hour in-home care is tremendously expensive, and it's not really an efficient way to provide care where you've got people driving all over town. So there's got to be room for all of these options, I believe, and I think we can do a better job as a field of helping people understand the pros and cons of each, because I think sometimes there are a lot of people who I'm just going to stay in my home, and they don't realize sometimes that that's not going to be the right option for them until it's too late.
Well, and I think that we need to respect decisions. I think we have some people who say, and family members who say, that their loved one should stay, and the person themselves says that they want to stay in their own homes because of fear of what the other options are. And I think that is important for us, that we all need to work towards dispelling that fear. And this is what we've been working towards, is really showing people what communities can look like. And that is so important in this conversation. I don't think it can be left out, that some people may like the idea of living in a senior living community, but what are their friends going to say if they tell them that they're moving in? Are they going to get that negative reaction? What is that going to look like? Or maybe they truly do have a fear because they heard of someone else's experience 10 years ago. It just, I think that perception of senior living plays into this as well.
It does. And not just perception, sometimes the reality.
Sometimes the reality,
right? Where people
that's sure.
Yeah. And right now it's even more scary for people, especially, to move into a place where you can't see your family members. And there are family members who are taking their loved ones out of communities because they're so terrified of what's happening with COVID. So it's just complex.
There are so many factors involved right now.
Yeah.
Exactly.
Yeah, absolutely. So there is a question from Jennifer. I'm curious about to what extent the innovation and creativity can become part of permanent practices. Certainly what is going on now is going to impact how communities are designed and regulated. Any thoughts about that?
Yay, Jennifer. I think that this is what I keep thinking about too. What are we going to be able to keep when we are on the other side of this? And I think that we need to be so intentional of doing that look back of, okay, what did we do? How did it work? How can we continue to implement it? Because as I said, I mean, there has been creativity across the board, I think, in senior living, and we cannot lose that. I challenge all of us to ensure that we don't go back to the status quo. And I think that one of the things that we can do is we need to keep having these conversations. All of us who have an impact in some way, shape, or form, whether it's the work we do, the consulting, the education, or just because we have an interest, we have an impact on senior living communities, we all need to be involved in this to ensure that this continues. And I think it's one of the reasons why we've been doing different types of webinars about it, why we've been putting out different information to ensure that some of these best practices that we now see continue.
Yeah, and really, I've found when I assume things, I'm wrong, and I miss things. And so what communities have been teaching us is when they're asking people, they're hearing different things. Like there's one specific organization that's part of our registry that said, residents are saying they kind of like not having so many people in their home. And they like not being shuffled from activity to activity and having more personalized small things happening. And so they are very intentional about, hey, we're not just going to go, oh, that's nice, and then move on to whatever comes next, but to really look at what are those lessons we're learning right now, and how can we do better based on what we're learning.
So much so. There's a community that we work with, and one of our former board members lives in that community. And one of the things that he's been telling me that's happened during this time that he wants to ensure continues are the individual relationships that have been built between residents and staff members, that there's a closeness there that they never had before. And he said, he always thought that, and he's a true believer that relationships are the fundamental building blocks. And he really felt that the community, the staff working in the community felt that way too. But he said it's been totally different. They started gardening during this period of the virus because they were just looking for different things to do as a community. The residents started it. Well, the staff, so it was resident driven, and then the staff came in and helped. And just through the process of gardening together, he said there's just been this closeness because it doesn't matter whether you live there or whether you work there, you're still experiencing the same thing with the virus. And
community, right? It's all about community.
Exactly. And so his fear is losing that, losing those relationships, closeness. And so, it is really interesting. And I think that, again, goes back to conversations. Communities, need to continue these conversations with residents and how they're feeling.
I think so. And I was just thinking when you were talking about what we've heard from some other organizations too, about the silos have been broken down and everybody's like doing everything now because they have to. And one organization, they said their corporate office was much more engaged in knowing exactly what's going on and knowing the people, even though they weren't there. And they were hoping they didn't lose those things, right? Those very strict and right, in an institutional culture, well, that's not your job to be out there doing gardening, Penny.
Mm-hmm.
But it is.
But it is.
We're looking at things differently.
Exactly. And I think that there was a question from Jenna.
I was just looking at that one too. Yeah.
That question too. Prior to no, that wasn't the one.
How do we approach trauma?
How do we approach trauma? And that just makes me think, I think that one of the ways that we need to approach trauma is to just realize that this is trauma for both the people who live there and the people who work there. And trying to actually have more of those conversations that include everyone, having safe spaces for people to talk about what they're going through. This is one of the things that I always advocated for as an ombudsman, that sometimes team members need to have a place to just talk.
Yeah.
And it has to be a safe environment where anything can be said, where they can have conversations with each other because they know best and they can relate best to what they've been going through. So it has to be the whole team together or small groups of team members together to have those conversations. But it's something I think that senior living and healthcare is going to be dealing with after this crisis of the virus, because what I'm really afraid of, and Jenna, I don't know if you were getting to this, but I'm really afraid that we're going to see people exiting the world of senior living, that we're going to see team members who are going to make a choice and say no more. And I don't want that. Those are the people who are so compassionate and caring that we need, but we need to make sure that we take care of people who are working in senior living. That has to be one of our priorities moving forward.
I agree, Penny. I share those same concerns because I hear from people, saying I'm going to stick it out to get my community through this. And this is from leadership, formal leadership, but I can't take it anymore because I'm doing all this work. And then I'm also being demonized in the media and just public perception. And we have to be really careful of that. And I also want to just make a comment on Jenna's question is, in the institutional framework of care, we were traumatizing people with the way we handled death before. And so I can't imagine in an institutional setting how painful it is now, right? Where we would, pretend like the death didn't happen and that this person didn't have this long relationship with this elder. And we're just like, get back to work. There's a new person that just moved in. And by the way, get all of Mrs. Smith's things in a garbage bag for her family to pick up. And let's have a monthly memorial service for all the people that died this month. Like, we've never been good at that in our field. And I know there are a lot of organizations that are doing better. But it really, it's about understanding and validating that people are hurting right now. I mean, losing your friends, the elders that and coworkers, it's tough times for sure.
That's a great point, Jill, bringing in how we've traditionally handled death in care communities, because truly it's been abysmal traditionally.
It has.
No doubt. And we have not been validating at all of people's feelings of grief and of trauma. And so you're right. We know that so many communities are doing so much better, but I just think that this I'm sure has exacerbated what's been happening in those communities that haven't changed their practices. And I can't imagine what that's been like, and some of those that have been truly hard hit by the virus.
Yeah. I can't either. So thank you, Jenna, for asking that really, really important question. And Jenna had another really great question. Prior to COVID, people have fears around long-term care. Now with the ramifications of COVID-19, fear levels are increased about moving into senior living communities. How do we approach this?
Yeah, this has been something that a lot of people are talking about, don't you think, Jill?
Yes.
We've been hearing these conversations. And I think and I can't remember who I heard it from that put it very simplistically, is that, we have designed traditionally senior living communities, and especially nursing homes and more assisted living communities, to be places where people go for care. And it's been for physical care, and we've not been able to ensure their physical care during the time of the virus. Well, I think that we all know that the piece that we've always wanted to bring in more, and that we have, is their spiritual and social and psychological care as well. And I think that this is where we need to focus on for senior living. It's always been more than the clinical care. It's always been more than the physical care. And those are the things that we have really seen that people have been doing well, so well in the past few months.
Yeah.
I think that senior living is going to have to focus on them more. And that's where people are going to need to sort of toot their own horn about what they've been doing and how they've been doing it. The image of senior living, we know we need to work on that image. And as you said before, just like anything else, we know that there are some communities that don't perform as well as others. But I think that it's going to take all of us to continue to work to change the image of senior living. We know there are so many great places out there, and people need to know about them.
Yes, absolutely. And I would just say, with the have to decisions, when somebody needs nursing home care and sometimes assisted living care, yes, I think people are terrified. There's only so long you can put off a have to decision, right? A want to decision, like moving into residential living or assisted living, where you could potentially still live at home without a lot of care and support. I really think that that's where this balance of life and infection control has to come into play, so that if people feel like they're going to be giving things up in their life to move in, that's, I think, going to push people to say, I'm going to wait a few years. But if it's a place where I can still have my life and I have support, and as a family member, if my parents were living at home in Western New York during this, I would have been like, oh my gosh, because I drop stuff off to them, and I know that the community is making sure that their food supply chain was, strong, and that things were going to be okay. I can't imagine how scary it would be to have, if my parents lived at home and I wasn't anywhere nearby, even though they do for themselves, just having to stay home. So I think there's an opportunity to showcase those supportive services. Like you're in your apartment, but you're not alone in these communities. As long as they don't, there's a fine line between being, this kind of community setting and being a jail right now. And I think part of it is if the residents are involved in working through these hard decisions with leadership, it makes people feel more, they support the decision more, and it doesn't feel like somebody's telling me what to do. Does that make sense?
Yeah, it makes complete sense. I really think that we need to give ourselves, and we need to give providers grace right now, because we are all learning and changing and having to make decisions very quickly. And as we said, things are changing very quickly as well. And so I think that as I said, people made decisions. Decisions were made to shut everything down for the right reasons. But now it's the stop and pause, at least if you're able to. In some states and some communities, maybe you're not able to because the virus is really impacting you right now. But in others, it's the time to pause and really start having these conversations on how to move forward, because it is that fine line. I mean, it really goes back to that fine line of safety and risk, and I mean, just what we talk about so much. But if we continue to basically tell people, for instance, like your parents, you know, who are living in a life plan community in their own apartment or their own house, we continue to say, well, you cannot leave. That's probably not going to help other people want to move into your community.
Right.
Now, if the conversations have been happening and residents are feeling like they're involved, that's a totally different thing. But if it's top down making decisions and there's no involvement by the residents, it's probably not going to be looked on very positively for others who are thinking about.
Right. Even if you had the same guidelines in place, it just feels different.
It feels different. And that's, I mean, it's one thing, right? The answers, the eventual decisions might be exactly the same. But how does it feel when you're being told you have to do something versus when you participated in the decision? And then it comes out that this is, you know, you have to do something. It's totally different. And I think we need to remember that.
Yes, absolutely. Absolutely. So Evie had a comment that the creativity has been in homes embracing culture change. Most homes have been practicing old model institutional clinical practice are getting more rigid now. And then Beverly had a comment that sort of ties in with this, that we need to be thoughtful about whether they are truly best practices because some facilities without COVID-19 might think all of their restrictions kept them COVID free.
I think that's a really good point, Bev. I think it's a really good point. And I think that it's probably also going to take us a while before we can really ferret out what worked and what didn't. I mean, we're seeing that, I think, with the virus right now, that we don't exactly know. And I think that idea, and I've seen it a few times in the chat as well, of this sort of fear and anxiety about what's going on with the virus has moved us to those more institutional practices and task-oriented practices is true, because that's where our feelings of control are. I mean, these are things we've wrestled with in the movement for so long. You know, when things start to get dicey in your community, you revert back to what's known, and that's those task-oriented ways of doing things. And so I am a little concerned that as we move forward, we may take a few steps back. And so that's why I think, as I said before, we need to be very intentional about some of these creative, innovative things we've done and how to sustain them.
Yeah. Absolutely. And, you know, I'm trying, we have so many comments coming in, Penny.
I see them.
So it's like Lisa Kendall, some easy legislative fixes to support elders and families with trauma, reimburse clinical social workers for visits in nursing homes, and continue Medicare reimbursement for teletherapy, which is temporarily allowed for COVID.
Teletherapy, I think that it has to continue. You're exactly right, Lisa. But I think that also the reimbursement for clinical social workers is something that has been an issue in long-term care, and something, you're right, that we need to fix. I'm not sure. I think that it's our idea that it could be an easy legislative fix, but I think that it's probably not going to be as easy as that. But I think that just the idea of more mental health services and long-term care overall is so important. And we have been so negligent in the way we have failed to reimburse for mental health services in the past. And I think it's just like the idea of social workers in nursing homes. I don't think that we've necessarily valued those positions the way that we could, the way that we could have. So
I agree, because usually the social worker is doing admissions and roommate challenges because we have multiple people living in rooms and Medicaid, and not, I mean, there's so much more that we could be doing with the social worker professionals in our communities.
Well, and I think telehealth in general is something that we need to advocate for continuing moving forward too, especially for those rural communities, not just talking about teletherapy, but telehealth services in general. This is something that is so needed in the world of long-term care. And it's great that we've been able to make these changes quickly in regard to the virus, that CMS has temporarily allowed this, but it needs to continue.
Absolutely. Absolutely. And, you know, when Bob Kramer from Nexus Insights was on the show, he was marveling at how all of these things that everybody thought would take forever, like telehealth, it happened like overnight. And so, you know, I think Lisa's right. Like, it is kind of easy, simple, but it's simple, but it's not easy to get done. But maybe in the midst of this crisis, there's more, we can have more of a push to have those things continue because we're seeing the benefits of it right now.
Completely agree. I think that it's been amazing to see what we have been able to do. And I think we need to fall back on that and make sure that we continue to actually do those things. And I do think now that we've set precedent, that hopefully that can continue.
Great. Well, I want to make sure we have time to talk about an exciting thing that is coming up in September. And Pioneer Network, like the Eden Alternative, we both had our in-person conferences scheduled this year and both had to be canceled. And Pioneer Network has decided to do a virtual gathering, a virtual conference. You want to talk a little bit about that and how that ties in with our conversation today?
I would love to. You know, when we had to cancel our in-person conference in Pittsburgh, we were so disappointed because for Pioneer Network, and the same for Eden Alternative every other year, this is our time when we all gather, you know, and this is something that we've all gotten used to and everyone looks forward to. And we said, okay, well, there needs to be another way that we can gather. And so we decided to have a virtual conference, a virtual gathering. And so it's September 1st, 2nd, and 3rd. We're so excited. And it's about the future. The title is Envisioning the Future 2020 and Beyond. So this is something, registration is going to open on Wednesday, this Wednesday, so everyone can look for it. And because it's virtual, we have the most amazing speakers, some that we would never have before. We have speakers from Australia, Israel, Spain, France, Canada, and then throughout the United States as well. And people that normally aren't able to come to our conference because of conflicts, because it is in August and things like that, are able to attend and speak. So we're so excited. We're going to be doing 45 concurrent sessions, 3 keynote sessions, the ability to get 51 continuing education credits, which, you know, we've never been able to get for an in-person conference. So this is so cool. Everything will be recorded. So everything will be on demand for 45 days. So you can get those 51 CEs. And we're so excited about it. You know, at first it was very daunting because we thought, well, we've never done this before. How are we going to pull it off? And now we're just excited. And Walter Coffey, I see that you're on. Walter and David Sproul are 2 of our keynote speakers. Denise Boudreaux-Scott is one of our other keynote speakers. And then we're having a fabulous panel about envisioning the future as well. That's going to be on our 3rd day. So really what we wanted to do is not only provide the networking that everyone comes to our conference for. So we have multiple opportunities for networking and discussion, both before the conference and during, but we also have sessions that are talking about what's going on right now. What's going on with the virus, what communities are doing for practical examples, and then looking to the future of what is the future going to look like for residents? What's it going to look like for leaders? What's it going to look like for team members? What's it going to look like for family members? And Jill, you're going to be facilitating that panel. And so we just have lots of different opportunities to talk and discuss everything that we're talking about today, but in much more detail. So we welcome everyone. This is an opportunity, because it's virtual, for everyone to join us.
Well, and we'll be there, and highly recommend that everyone be part of this. I mean, I think it's the gathering that we all need right now to really think ahead. And one of the things I love is with these panels is it's different perspectives, right? It's not just people who work in a community talking about what they think should happen. There's elders, there's family members, just all these different perspectives that I think we all desperately need right now. So yeah. That's awesome, Penny. I'm so excited about the Envisioning the Future Pioneer Network Conference. And I do want to just, before we close out, Walter Coffey had a comment that I just wanted to call out here. And Walter and David are in Spain, living there, and have been doing a lot of work with person-centered, person-directed care. And Walter says that person-centered nursing centers we've heard from in the US and Europe say that with the COVID experience, they would not change their model or their approach to care. They noticed staff were empowered to make regular decisions with residents, and because they really know them deeply, they were able to be more proactive, an advanced sense of commitment. And Walter, that's exactly what we're hearing from organizations that have really strong cultures already, and that foundational person-directed work has been done. Is they're still having a hard time, but they're getting through it in a better way. So I hope that this conference is an opportunity to introduce even more people to some exciting and new ways of doing things. So Penny, thank you. Thank you.
Thank you, Jill. This has been great. Wonderful to have the conversation with you.
It's so great to learn from you today. And thank you so much to the very lively and active group of people who joined us today. Your comments and questions were fabulous and really added so much to the show. I hope you'll join us next Monday, July 27th. We have Heidi Wagner from the Passions Project joining us to talk about her work. Heidi is a photographer that focuses on passions. And if you haven't seen this yet, on July 22nd, so that's Wednesday this week at 3 o'clock Eastern time, we have our online virtual launch party for Evolve Online Learning, which is the Eden Alternative's new virtual on-demand learning platform. So I hope you will join that party on Wednesday afternoon. We'll put the link in the comments. And if you join that, you get an additional discount on purchasing courses on Evolve Online Learning. Thank you so much to everyone for joining us. And Penny, thank you so much for your time today.
Thanks, Jill.